19 years ago.
Yeah. So how did it happen?
So we were living in San Diego, and I was always in sales, and we used to own our own restaurant and sports bars, and we were entrepreneurs. And
Is it
but
on the wharf area, by the way?
no, it was in San Diego. We had a restaurant actually on Brown Airfield.
I know what that is.
Yeah. So anybody flying private charter had to stop in our restaurant. That was kind of a hoot. So, but I was working corporate world for AT&T, GTE, AirTouch. It turned into different things in the San Diego market. But I had the great experience of working with the San Diego Chargers, the Padres. I took care of all of their wireless needs before wireless was huge. So I call myself a dinosaur in the telemarketing world. Anyway, teleworld. So my husband said, my parents are very sick and I would love for us to now move to Pensacola, Florida. And I had to literally go find a map and find out what he was talking about. And so he said, I'll tell you what, Sally, if you don't fight me on this move and come to Pensacola and leave all of your friends and family in San Diego, I will start going to church with you and the kids. So in my opinion, it gave me great peace because it was a done deal right then. Because he was always working all of our entrepreneur businesses. And so he never went to church with us. And I literally had somebody ask me once when he finally could come on a Christmas or something, oh, we all thought you just wore a wedding ring, but you weren't really married. So what a great testimony that my big joke is that we moved here for my husband's salvation. So, and he stuck to his word, and he joined a men's Bible study with Michael Caro and a bunch of business people, and people were coming from Mobile here. And so he found his people, and he's done it for 20 plus years.
Our Michael Carroll from...
Yeah.
Oh my gosh.
It's such a small world. And Bill Spain,
Yes.
Hallelujah Bill, we call him. He'll be at the gala this year. But anyway, what a great story that is. And so I just had, people were like, how are you not freaking out? I was the kids' PTA president of the whole school, and they had us on the marquee that we were leaving. And I just did not freak out at all. I had such a great calm about it. And then it was such a God thing, right? That we had 4 businesses and a house, and it all sold within like 30, 60 days. I mean, if that wasn't meant to be, right? So we get here, and this was one of the first little fundraiser things we did, was we went to a Health and Hope. Their very first Christmas gala was in their new building, and we went to it, and I said, this isn't even political. It's not any, how can you not get behind something so amazing? That the fact that like we've grown tremendously since those days, but the fact that we still only have 5 full-time employees, I mean, it's not our work, it's God's work, definitely, because, and if I had $1 for every time someone came to me and said, it's so busy, there's no way we can continue doing this with just volunteers. And I always stop in my tracks when people say that to me, because they do it a lot. And I look at them in the eye and I say, he always provides. And we've been doing this, the impossible, because people say it's impossible. We've been doing the impossible since 2003.
How'd you come on board, though, as a director here?
So I had a fabulous job that I loved, and I was working as a kind of a nurse recruiter and doing all the corporate training for Nurse Spring that has offices from North Carolina all the way down through Tampa. And so I had an amazing job where I also got to be the liaison for Pensacola. So I had to join the yacht club, and I had to have the opera tickets, and it was just this amazing, awesome job. The owners were so good to me. And when I was approached to interview for the executive director job here, I said, I can't do that unless you take my owners to lunch and get their blessing. And one of the owners is on my tennis team with the girl that helped start the Health and Hope Clinic. We were all on the same tennis team too, so that didn't hurt or help. And so they went to lunch, and then I interviewed, and it's been a home run since.
Sally, what an awesome employee, loyal employee, to say you've got to take my boss before I can. Wow. Okay.
Well, right. I mean, they were just too good to me. There's no way I would have ever consciously, leave without that
It's
blessing.
a classy move, though.
And they blessed it, and it was really cool because now they're still a part of my life because they give and give and give till it hurts to this clinic. So
How much has changed? I wasn't expecting to ask you this, but how much has changed from when you got here to now? Obviously, a lot. But was the structure already in place and they were already doing these wonderful things? How did you help?
well, yeah,
Grow
absolutely.
or formation or
Yeah. So when I got to the clinic, I joined the team in August of 2019. And the first thing we did is they threw me up on the stage in the ballroom at the Hilton at the beach because I had to fight for a grant that Sarah had written. And Mike Johnston,
previous Sarah?
Sarah Davy, that helped start the clinic in 2003. So they said, yeah, you need to be the face on this. So these, doctory people, that wrote this medical grant, I said, well, I got to know what I'm talking about. And if I don't understand what you guys are saying and what I'm reading, how is the Impact 100 ladies going to understand it? So it was kind of a cool process because I made them explain. I said, pretend like you're talking to, women that aren't in the medical field. And let's break it down and figure this grant out. So that's how I sort of started in this role. Is I got thrown on the stage and said, you're going to be the face of Health and Hope. So I had to really kind of figure it all out very quickly. And the very first thing I did was look at processes at the clinic. When I started at this clinic, we were sitting at about, on a really high-end year, we were about 600 patients. We're now way over 2,400 patients. So that is quite an amazing amount of growth in a very short amount of time. So, and the projections are there. I even had like a dictograph done of like the volume of dental patients and medical patients and mental health and pharmacies. And we did 4.5 million in pharmacy last year. And so it's just neat to see it going up and up and up. And I showed this pictograph to my husband. He said, yeah, if that was a stock, I'm all in, because that's how busy it's been. So it's just really easy to do the work. I've never worked so hard in my life. I mean, I'm just going to say that, but it's all so great that I feel like I'm helping in a bigger way than when I was in sales and winning all of our vacations every year, because I'm a good salesperson. But to me, this is just so much more of a ministry. So it checks all the boxes for me that I can still, I can do what I'm feeling led to do. I think I'm pretty good at it. So the first thing I did is look at processes. I sat in that front room like I was a patient waiting, and I timed things. I looked at things. I looked around what else is around this campus that we should be working in coordination with each other. Social determinants of health are everything in the health world, and we had a food bank right next door that we weren't even talking about or acknowledging. So just kind of looking at that 40-foot view and figuring out how this could be all more inclusive, and really address a whole patient, mind, body, and soul.
You really have been the perfect person for this, dude. I mean,
Well, I'm having a lot of fun just figuring out what else should we be doing.
I've been around a lot of folks over my years, especially in the journalism side of it. You're very impressive. Just say that.
Thank you.
I bet you can't pinpoint the most rewarding. But can you give me an idea of a few examples that have just stuck with you, that made you say, I made the right choice without a shadow of a doubt? Because.
Yeah, so I think it's interesting. Okay, so the timing, it's all God's timing, right? So I made the leap over to Health and Hope in 2019. Well, when did COVID hit, right? 2020. So it was just so beautiful. I mean, it's like everything unwrapped the way it was supposed to, right? So we become the official Northwest Florida distribution site for Narcan before anybody was talking about opioid overdoses and Narcan. I had to explain it. I became an expert on it just having to explain it so many times. So right about that time, COVID starts happening in 2020. Well, through that grant, I had friends in high places, and I just needed a little bit of money to show good faith. I did it on a leap. We started these billboards, and they got me like, basically down onto the bare. Remember, I'm a sales background, so I could talk them down. And so all these billboards went up, and then COVID hit. So we already had a kind of a way to talk about what we were doing. And then the money came in. I mean, that money that year, my first year with the $100,000 grant, when our whole entire budget was only like 150, maybe 200, it was a game changer. So I'm all about the collective giving. So I thought that was kind of a pivotal moment where I thought, God, I followed you, and now it's working out. When everybody else was getting bank loans because their business models had changed, our business model changed a lot. They weren't waiting all in a waiting room. We had a pergola built off of another grant that we beat everybody out for because of COVID, and people needed a place to wait outside. But in addition to that, it was just so confirming to me that I was in the right place at the right time. And with that little bit of money, we were able to do some really great things. We had our record-breaking year that year, financially, patient being seen wise. It just all unfolded the way it was supposed to. People were asking me, are we going to close like a lot of other places are closing because you're losing a lot of your senior volunteers, and people don't know where this virus is going to go. And what about, are you going to mandate everybody be tested or vaccinated? There was all of that controversy going on. And it was just so great to have really great people around me supporting the Health and Hope Clinic that I could turn to. And one of the biggest things I learned was I don't have to be the expert in all things as long as I know really great people to weigh in. So that's what happened. So I talked to Dr. McLeod as our chief medical director. He is an amazing man with a great street sense. Common sense is not so common. I'm around a lot of brilliant people, but this guy has got great common sense. And he said, at the end of the day, Sally, our job is not necessarily to tell people what to do. Our job is to be available to educate. And then if they choose, we vaccinate and be ready with that vaccine. So we did everything we could to be qualified. It just goes on and on from there. But it really was a great unfolding of I was exactly where I was supposed to be at the right time. And then people kept saying, are you going to close because of COVID and you don't know where the virus is going? We went back to the mission statement, and I said, absolutely not. Our mission statement is we are here to provide health and hope for the hurting and underserved. Why would we close our door when they need us the most right now? So I fought like heck to keep that door open. And there were times when I was like a greeter at the door trying to direct traffic. Okay, our pharmacy we're still doing the medicine, but they're going to come outside to you, even though we weren't set up to have a drive-through window, but we made it happen. We had a protocol. We created signs, call us when you get here. Our pharmacy would go outside, have them sign on the iPad. I mean, it was just beautiful the way we were able to kind of negotiate and be creative and innovative with what we had in front of us. All the students at the time were being kicked out of their hospitals because the hospital's liability, but I have sovereign immunity. I can give a very hands-on experience. So we said, come on into the Health and Hope and we'll find a place for you. And we never missed a beat.
So does Sally ever get tired? The energy of what you're doing just gets you through. Do you crash at night?
No, because I'm going through all the things that we need to still be doing, right? So I think that's the hardest part is I just feel like there's just so much more we could be doing. And I have to remind myself, because I'm very project focused, let's move on to the next thing we're supposed to do. And I have to sometimes remind myself that I have to sometimes be still to listen, right? And that's really quite the art that I'm still working on.
Yep. Speaking of those projects, can you give us a hint of one or two that you think? And if you're not ready to say that,
that's okay.
Fine. Are there one or two that you want to implement next? What's the next thing for?
So the next thing, and I think it's really soon, and we sort of have touched on it, but we're going to take it to the next level. We started doing a lot of outreach and education through a wonderful grant we got 2 years ago that I was the primary writer on, believe it or not, even though I'm not medical. We had Dr. Erin Mayfield, after I put the framework on it, she went in and just kind of gave me those doctor words, and Monica Sanford, our heart cardiologist, specialist, came in and gave me a bunch of great things to throw in there. And we won this national grant, and we were the only entity, our little Health and Hope clinic, that was renewed a second year. And they said, you don't have to write a grant for this. We just want to be your sponsor. We're so excited about the data and the stuff that you guys are doing with very little resources. You really make it go far, and we're so impressed. So they revived us for another 100,000. And so through that, we were able to kind of get this whole synergy started with going out and educating people out in the community, doing those quick health checks. But I think we're on the verge of something even bigger. We're going to start almost like be a mobile unit. I don't want to have a mobile car. I don't want to have to do maintenance. I don't want to get into all that. But you can be a mobile unit without the car. And I want to take it to the next level. We're going to do cholesterol testing. We just got interviewed because we made it out of a national grant with Heart to Heart is what they're called. They're going to come now after Christmas and do a site visit because we're in the top 10 contenders for this big grant to do our own labs. And it's just endless what we could do, but it's really neat what kind of impact we could make if people could just stay here and do all of that lab work and stuff. That'll really kind of make it go to the next level, in my opinion. And I have an A player right now, and right now I'm happy just getting a little bit of my A player, but I think I'm going to have that funding to be able to take the clinic to the next level. She's going to be able to she's going to be able to automate a lot of processes because she's innovative and she has that technology side. Right now she's doing all my healthcare data, and making sense of it and creating pie charts and graphs, and it's just endless. So sometimes it's just finding the right people at the right time, and then you get the funding, and then it just kind of all unfolds together like this new building we just built. Right. So it just goes on and on. But yeah, I think that's going to be like our next game changer.
Cool. Talk to me briefly about what we were talking about the first day I met you on getting people to come in, like to participate in the diet or the cooking things that you do, exercising programs. Tell me about that need and how you want to grow that side of it.
So this all started, I'll make it really quick. A patient came to me once who I had gotten to know, and she would come to the clinic even when she didn't have an appointment, just to come by and say hi and let me know how she was doing. And I love that. And she said, you know, what I really like about coming here? I said, what? And she said, it's more than just a clinic to me. It's like I found my health home. I found my people. And you guys will listen to me even if I don't have an appointment. So her big thing was I was chronic, and you guys didn't just hand me my diabetes diagnosis, my label, but you got right next to me and said, now we're going to get you a fruit and veggie box. And now we're going to get you enrolled in these exercise classes, because we have the exercise physiology students 4 days a week doing classes day and evening. And then we're going to have our DO doctor and our nurses that teach cooking and Evermans. They're going to give you the Grocery Advantage shopping list, and they're going to show you how to really do something with these fruit and veggie boxes. So now we're not just treating the problem that's in front of us, but we are getting behind them and really moving that. The whole outcomes are going to be better. We're not just treating a diagnosis and putting them out on the street. So she said that. She goes, I like that you didn't just treat me and street me. I thought that was a cool term. She goes, you guys came next to me, and now I'm changing, like making lifestyle changes that I think are really going to make me last longer on this earth. Health outcomes.
And then the mental aspect of being, we talked about that because I was sharing with all these other guys that it's cool. I mean, we all go to health facilities, but typically the mental side of it is like another side of town.
Right.
Maybe you don't even think about that because we're going to address what your physical is, but nobody ever asks me, well, how you doing up here?
Right.
Different ball game here.
But it's amazing because it is all linked together. Everything is linked. Most diseases, they say 90% of diseases start in the mouth. So we've got the dental with that. Well, now we know what we put in our mouths affects everything in our body, including our mental state. I know I don't feel good if I had a crappy fried food meal the night before, as well as I feel when I start off the day with a nice smoothie and I got my tennis in at 7 a.m. and hit a ball for an hour and a half before I got to the clinic, right? So if we think in terms of what works for us, I mean, we're all humans. We all share the same basic needs, right? And so in order to move, in order to really help people, I feel like we needed to offer the whole package and be a one-stop shop as much as possible. Now, I'm not implying at all I could not do this job here. We could not do what we do at this health clinic without the support of the big three hospital entities and our big FQHC here, which is Community Health Northwest Florida. I mean, so it takes a village, but I love getting to brag out in the community. I'm not in competition with anybody because I don't take money for what we do. What we are doing is in our wheelhouse. We are right where we're supposed to be. I'm looking at zip code data from United Way every month. I'm looking at what are the biggest needs being reported out in the community. We have a needs assessment that goes on monthly with United Way. I love the fact that this zip code is one of the top 3 month after month, and healthcare is one of the top 3 categories of need historically every single month for the last 2 years. And guess what? I mean, so people that don't have healthcare, they don't have Medicare, Medicaid, they're falling through the cracks, and that's where we really kind of step up, and that's where I think our role is with the community. But the more I can get in one-stop shop, even specialists. So our new big, our new secret sauce is having all these specialists that come in and they're seeing the patients here and they're doing the vetting if they need something more complicated like a surgery. So Sally saying, I have a patient that needs a surgery has a very different feel than if I have that specialist that already works at Baptist or Sacred Heart or West Florida, and they're saying, yeah, this guy needs a life-saving surgery. We got to help him do this. They're all getting approved now because we are really taking it to heart that we don't want to waste the big hospitals' money. We're trying to keep them out of the ER. In fact, we're doing a whole data slam about how are we keeping them out of the ER, and what does that look like in numbers, and what's that savings cost for the hospitals? And that's really, I think, a big part of why they're supporting what we're trying to do.
And has the mental side, have you been able to see a benefit yet? Or is it, I don't know how long, I forgot how long you've been.
Yeah, this wing opened in late January, but I knew it was going to be opening before we even had the money to open it. So I started recruiting. I got somebody, Michelle Salzman's our state rep, and she has a great personal story. And she came to me and said, let's start, like I'm hearing all the need. Let's start a mental health task force. And with her influence and people that we all knew together, we were able to get like all the big wigs at the table that could really move the needle with help with mental health. And with Mark Faulkner at the table, CEO of Baptist, and we have Will Condon at the table, the CEO of Ascension Sacred Heart, who's on our board, and all the other entities, Kendrick Deutsch from West Florida, HCA. We were able to get everybody around the table, and the sheriff, Chip Simmons, was there. And then we had all the other health entities. How many beds and heads can you have? And we got everybody together and we did a needs assessment. And then we came up with a strategic plan. And now we are 99% there of filling that strategic plan. We just opened our central receiving center over at Lakeview. So now now we have to train everybody not to call 911. And in fact, to call 988, which is the mental health crisis line, and then we can divert them for services. We even have a unit team that comes to the place to get the patient and bring them back to the central receiving center with a 24/7 person that can do an assessment on the patient, because not everything's a Baker Act either if someone's acting different or having a moment, So anyway, it's just amazing to see when you get everybody together where our place is. And I think really the Health and Hope Clinic's role is to offer a ton of health education and mental health group counseling. We do the individual counseling. We're on the preventative side. And then we're doing we can do their meds. We can offer so that they're not shopping on the street and becoming drug addicted because they have tooth pain. We're doing all of that on the front end for people that otherwise would go shop on the street. And then we're doing a ton of screening on the front end from the time they go into intake. We're doing a screening, and they think we're getting their history, and we're actually doing a psychosocial survey mixed in with their history. And so we're identifying if there's a need for mental health right off the bat.
Yeah. Last question I have for you, unless you've got something else, is I don't even know how to ask you this, but can you imagine this community without this facility?
There's been times where, you know, when you're in the administrative role, I guess you would call me that, although I'm, yeah.
Hands-on.
Right. But in an administrative role, a lot of your work and your efforts is the behind the scenes, okay, getting the funding secured and understanding it just enough to be dangerous on the medical side of what the needs are. Because I'm the one writing this. And I've been asked over and over, are we there yet where we can employ a grant writer? But it's almost like taking my soul. I mean, you know, how do I know they're going to be able to explain what we're trying to do as well as I can explain it, right? So it's almost like it's almost become personal to me. I've had to let a few helpers come and help me because there's just so much. And we've had a little success with that, where I think we're going to be getting a pretty big grant here in the next month or so. But having said that, it's very personal why I come here every day. And someone said to me, "Why do you come every day? This is supposed to be a flex job. You could just do a lot of this from a laptop at home." And now that we live at the beach, that's very tempting. But I feel like my role here is so much bigger than that. I need the pastoral people to see I'm here every day too, right next to you. I want to know every name, so that's why I take on all of the onboarding. As far as anybody that has filled out an application, I get to meet them before they start. That's kind of cool. What was your question?
Ownership.
I can't remember your question.
It was basically, can you imagine this place not being here?
Oh, right. So, but sometimes when you're in the administrative side, you're looking at numbers and volume and stuff like that. You don't get to see the personal stuff. So that's why when I get frustrated here at the clinic, I leave this desk and I just start walking the halls. And every time I've done that, or I walk through, I have to walk down the steps through the parking lot to get to my mailbox for the clinic. So on my way there, it is never happened where I'm not stopped by a patient. And I don't even know how they know that I'm the executive director, but they do. And they stop me and tell me their stories. And that's how I know that we're making a huge difference. But sometimes when I'm sitting in the office, you know, especially till midnight writing these grants and meeting these impossible deadlines because they think we have secretaries. You know, we don't have a secretary. I'm the one making all those copies and I'm the one, you know. But not really, because it's all these awesome people that are volunteering and helping. But at the end of the day, I am assured now every day that I get out from this desk and I walk a hallway, I'm stopped and I'm told these stories. And that's how I know we're right where we're supposed to do. We're doing what we're supposed to do. And he is ultimately in charge. When I start getting a little anxiety about a panoramic x-ray machine that's about to break, that's $80,000, this is a true story. And this was in my second year here. The day it quit working, a dentist randomly picked up the phone and called and asked to speak to me because he was upgrading his machine and he was going to give me his Mercedes for free. And it happened to be on our same street. I mean, I don't write this down. I can't make it up. I have to share this story. When Hurricane Sally hit, which does not escape me the name, I have a memory of coming down to the clinic, just leaving my neighborhood at the time up on 9 Mile. I had to avoid trees that had fallen, but all I could think was I have to go see what's happening with the clinic. And at the time, we had medicines in like a Sears kind of refrigerator situation, and it was 2020 because anyway. So I get to the clinic and I'm trying to save the medicine. I brought coolers to save them because we don't have a sophisticated system to shut on or shut off. And I get a phone call because we're part of the National Association of Free Clinics and we had just won a big grant. And they called me and from AmeriCares and Direct Relief and said, "We heard you were hit pretty bad. What can we do to help Miss Burgosh?" And I said, "I'll tell you what you can do to help. I need a real pharmacy refrigerator." They did it orally over the phone, verbally over the phone. They took down my notes. I had a check for $10,000 by Friday. I had my med students researching what kind of a refrigerator we need, because I don't know anything about refrigerators. I just work here, right? So they did all this research. We found out what Sacred Heart was using. By that Friday, I had the check and the refrigerator was delivered. 2 months later, they came out with the vaccine for COVID. And guess what? Only people that had the right refrigeration got to get the vaccine. And we were home free. We got a $350,000 grant to do vaccinations across the county.
Amazing. You really do believe that God and faith has everything to do with this place, don't you?
Everything to do with it. And when I start getting stressed out because something's about to break down, we just had something break down in our dental again. Dental's the most expensive thing we do here. I just say, God, you're in control. Here's all the grants I just applied for this month. Make one of them happen. And he just takes care of us. It's pretty amazing. But every dime that we get locally means more to me than anything, because it means that people are watching and they see what we're doing. It's pretty amazing.